Now let's start with the first question. The nurse is performing an assessment on a client who is at 38 weeks gestation and note that the fetal heart rate is 174 beats per minute. On the basis of this finding, what is the priority nursing action? Option A, document the finding. Option B, notify the obstetrician. Option C, check the mother's heart rate. Option D, tell the client that the fetal heart rate is normal. Now for this question, the correct answer is option B, notify the obstetrician. Now let's move to the rationale. The fetal heart rate depends on gestational age and range from 160 to 170 beats per minute in the first trimester, but slow with the fetal growth and range from 110 to 160 beats per minute. If the fetal heart rate is less than 110 beats per minute or more than 160 beats per minute, with the uterus at rest, the fetus may be in distress. Because the fetal heart rate is increased from the reference range, the nurse will notify the obstetrician. Options C and D are inappropriate actions based on the information in the question. Although the nurse documents the finding based on the information in the question, the obstetrician needs to be notified. Now let's move to the second question. The nurse is conducting a prenatal class on the reproductive system. When a client in the class asks why the fertilized ovum stay in the fallopian tube for 3 days, what is the nurse's best response? Option A, it promotes the fertilized ovum chances of survival. Option B, it promotes the fertilized ovum exposure to estrogen and progesterone. Option C, it promotes the fertilized ovum normal implantation in the top portion of the uterus. Option D, it promotes the fertilized ovum exposure to luteinizing hormone and follicle-stimulating hormone. Now for this question, the correct answer is option C. It promotes the fertilized ovum normal implantation in the top portion of the uterus. Now let's move to the rationale. The tubal isthmus remains contracted until 3 days after conception to allow the fertilized ovum to develop within the tube. This initial growth of the fertilized ovum promotes its normal implantation in the fundal portion of the uterine corpus. Estrogen is a hormone produced by the ovarian follicles, corpus luteum, adrenal cortex, and placenta during pregnancy. Progesterone is a hormone secreted by the corpus luteum of the ovary, adrenal glands, and placenta during pregnancy. Luteinizing hormone and follicle-stimulating hormone are excreted by the anterior pituitary gland. Now let's move to the third question. The nursing instructor asks a nursing student to explain the characteristics of the amniotic fluid. The student responds correctly by explaining which has characteristic of amniotic fluid. Select all that apply. Option A allows for fetal movement. Option B surrounds, cushions, and protects the fetus. Option C maintains the body temperature of the fetus. Option D can be used to measure fetal kidney function. Option E prevents large particles such as bacteria from passing to the fetus. Option F provides an exchange of nutrients and waste product between the birthing parent and the fetus. Now for this question, the correct answer is options A allows for fetal movement. Option B, surrounds, cushions, and protects the fetus. Option C, maintains the body temperature of the fetus. And option D, can be used to measure fetal kidney function. Now let's move to the rationale. The amniotic fluid surrounds, cushions, and protects the fetus. It allows the fetus to move freely and maintains the body temperature of the fetus. In addition, the amniotic fluid contains urine from the fetus and can be used to assess fetal kidney function. The placenta prevents large particles such as bacteria from passing to the fetus and provides an exchange of nutrients and waste products between the birthing parent and the fetus. Now, in my presentation, my reference book have used SAUNDERS Comprehensive Review for the NCLEX-RN examination 9th edition. So please promote my channel by subscribing.